Hello, and welcome to this edition of Bioethics Update, a service of the Center for Practical Bioethics. Thank you for joining us. My name is Terry Rosell. I serve as the Rosemary Flanagan Chair at the Center, and my guest today is Dr. Lindsay Allen Williams. Our topic today is thinking about Missouri Medicaid expansion, which will be on the ballot very shortly in Missouri as we're talking today, the early part of July. So I've asked Dr. Williams to come and talk with me a little bit about her thoughts and experiences around Medicaid expansion since she is practicing medicine in Missouri. So just to begin, Lindsay, and is it okay if I call you Lindsay?
Absolutely.
If you could tell us about your practice, what you do, where you do it, for how long you've been practicing medicine.
Sure. So I graduated from family medicine residency in 2016, and I worked at a critical access hospital in rural Missouri from 2016 until November of 2019. And I worked in multiple settings. I worked in the outpatient clinic. I worked in the hospital. I rounded on patients in the hospital, and I worked in the ER. And I also took care of multiple patients in a couple different nursing homes. And I recently took a new position, a new job at St. Luke's Health System in Kansas City, Missouri. I now work at St. Luke's North Hospital, and I am doing all outpatient work.
Very good. So you have had, interestingly, both rural family practice experience and now urban, sort of suburban.
Suburban. I'd say more so suburban.
Thank you. So how would you describe your patient demographics? And I suppose you can reflect on both settings, which probably are at variance with one another, but your patient demographics, especially in terms of socioeconomics and insurance.
Sure. So currently at St. Luke's North, it's located in the suburbs. And so most of the people I take care of have insurance. And if there may be a few patients that do come in without insurance. However, usually it's really cost prohibitive to continue to get care. And so at that point, I usually refer them to a safety net clinic. Prior, at my previous position, in a rural area, a critical access hospital actually gets federal funding to help keep its doors open. And so we oftentimes see patients without insurance. And so I saw a lot of poor patients there too.
Okay, that's interesting. So then you've got some comparisons to make as well, now that you're thinking about what voters are going to be thinking about in a very short time in Missouri. Since you agreed to do this brief interview with me, I assume that this issue of Medicaid expansion matters to you. Why does it matter to you, Dr. Williams?
Yes, it matters a whole lot because without insurance, unfortunately in America, health insurance is oftentimes tied to employment. And so if you're without a job or in between jobs, all of a sudden you don't have a way to get care. And so being able to go to the doctor and seek care is important to maintain your health. I think it's important for the health of our communities, of our countries. And so I feel like this expanding Medicaid in Missouri is just one step towards helping us reach that goal, keeping our communities and our country healthy.
Do you have any patient anecdotes? Something that you could share without violating patient confidentiality, of course, or HIPAA privacy rules. But do you have any anecdotes that you could tell it that motivate you to work for Medicaid expansion?
Absolutely. I don't even have to share a patient story. I can just tell you about my family. I have family members who have been between jobs, out of job, out of work, and have high blood pressure. He had high blood pressure and was unable to see the doctor just because of the expense. And so what he would do a lot of times is just go to the emergency department and end up using the emergency department for his primary care. And no one should have to wait until their blood pressure is dangerously high and they're at risk of stroke before they get care. No one should go to the emergency department just to get refills of their blood pressure medication. And so it's very personal because it impacts people in my own family. And yes.
Can you think of any situations, maybe familial or with your patient population in the last several years, including residency, I suppose? Any patient situations that likely would have turned out differently had they had access to Medicaid? And the problem that many of us perceive is that that adults can be really pretty socioeconomically deprived, marginalized, vulnerable, and still not qualify for Medicaid, and therefore don't have insurance, and therefore don't access even primary health care in a timely fashion. There are all sorts of situations that arise. They end up in the hospital, or they end up in the emergency room, or they end up in your clinic. Any situations where you thought, you know, if they just had insurance, if they could just help them get insurance like Medicaid, this would be so much different?
Sure. The first thing that comes to my mind off the top of my head is a gentleman I took care of at my previous position when I was working at a critical access hospital. And he was a truck driver, worked really hard every day, long hours, and he did not have insurance. And he had COPD. And diabetes and COPD, I feel like those two diagnoses have like the most expensive medications. Insulin is really expensive, and inhalers just really expensive. So a lot of times I felt like he was on the brink of a COPD exacerbation all the time. You know, he would come in and be wheezing and short of breath, and I'd give him samples, and I'd give him prescribe him medications that were less expensive but less effective, and you know, do the best I can. But because he didn't have insurance, he couldn't afford the $400 inhalers that were needed to really manage the COPD. And he was just close enough. He was like, he was a year or two away from getting Medicare. And so he just kept saying, if I can just hold on long enough until I can get Medicare, then I'll be okay. And it's really frustrating seeing someone who works every single day, putting in long hours, and they are unable to get the health care that they need to be healthy.
That must be incredibly frustrating.
Yeah, it's very, very frustrating. And I felt, you know, guilty and terrible all at the same time, because I, you know, felt like I couldn't do enough, or I wasn't doing enough.
If Missouri Amendment 2 passes, how will it impact your ability to help patients? And maybe less so now, given that you're working with a mostly insured population, but I suppose some of them, some of your patients still fall into the gaps. So either now, or, you know, or as you reflect on some of your patients from the past, if this passed, how would it impact your ability to help them?
I could take much better care of my patients if Missouri passed Amendment 2 for Medicaid expansion, period. Even though I don't have as many uninsured patients, I still have uninsured patients coming into my office now who are paying $150, $200 per visit because they know it's important to their health. And because of that, a lot of times, they can't come in as frequently and they can't get the lab work done or the imaging done that they need to, because on top of paying for the doctor's appointments, they are trying to, it's just too much to pay for all the other testing that needs to be done. And so in some situations, they either really spread out, they don't come in as frequently as they need to, or I end up losing them to care. They just stop coming to the doctor's office and getting the care they need. So Medicaid, expanding Medicaid would really improve my ability to take care of people. And I think it'll make a big impact on keeping people healthy in Missouri.
As we're recording this, we're about 4 months into awareness of pandemic here in the United States, and dealing with that in all these various ways that we're doing so, including in healthcare and as a physician. So are there correlations between caring for patients in a time of pandemic and access to Medicaid?
Well, absolutely. Absolutely. And I'm assuming what you're asking is, will the need to seek out medical care increase in the context of a global pandemic?
That,
absolutely.
And and maybe even primary care. And this, I haven't thought about this before, and I hadn't given you this question to think about in advance, but I'm thinking now, we're still in pandemic. People are still getting infected. Some of them are getting sick and coming to see their physician, or they're not doing so. And a lot of that depends on whether or not they have insurance. There's some funding that's been made available to try to increase access for COVID testing and that kind of thing. But are there any other ways that having insurance, having Medicaid, would improve your ability to care for patients during pandemic? I guess that's what I'm thinking.
One of the obvious things I can think of is a lot of times, for example, the testing sites at St. Luke's require a doctor's order. So, and I can't speak for other hospital systems, but I'm assuming it's probably similar for other hospitals in the Kansas City metro area. But at least for our system, I know that in order to get tested for COVID-19, people need a doctor's order. And so in order to have a doctor's order, obviously you need to have been seen as a patient. You need to be a patient of the system. And not having insurance is a barrier to that. Fortunately, there are some free testing sites that the Kansas City Public Health Department have throughout the city. But once again, not having insurance is yet another barrier to getting testing in a timely manner. And when you are infected with COVID-19, with a coronavirus, and there's a delay in testing, then there's a chance that you can develop more severe, significant disease. So definitely being insured, not having insurance, it just shouldn't be a barrier to getting the care that people need.
Is there anything else that you'd like to say about Medicaid expansion in Missouri? Anything else?
Absolutely. Vote for Amendment 2. It's going to help doctors take care of their patients. It's going to help keep your neighbors and your family safe and healthy. And it's going to honestly help keep hospitals open.
Thank you, and thank you, Lindsay, for what you do. We shared a little bit of conversation before I clicked record, reflecting back on all of the years of your preparation that we've known each other, your preparation through medical school and residency, and now several years practicing as a physician. We don't take that for granted. And I want to thank you not only for this interview, but for the care and compassion that you exercise every day when you take care of our neighbors out there in the community.
Well,
And
thank you so much for having me. Really enjoyed it. I appreciate it. Thank you.
Thank you. And I was going to say, especially so in pandemic times, which will make it even more difficult. And thank you, viewers, listeners who have joined us today. We appreciate your listening to this edition of Bioethics Update, which is a service of the Center for Practical Bioethics. I'm Terry Rosell. And if you have questions, ideas, comments, suggestions for apps for future interviews, topics that you want to email us, find our contact information at practicalbioethics.org, practicalbioethics.org. Thank you for joining us. Stay safe, be well.